Meanwhile, I'll introduce the chairs in this session. There's Dr. Altune Agoglu. He is the Vice President of LMHI. He's one of the founders of the first homeopathic association in Turkey, the Classical Homeopathic Association in 2003, and is the president of the association since 2013. He is a member of the LMHI since 2007 and National Vice President of Turkey between 2007 and 2016. Member of the working group of the Complementary and Alternative Medicine Turkey Health Ministry. Member in the LMHI Political and Education Working Group and a member of the ECH Political Subcommittee. Head of the delegation of the Turkish Standardization Institute in the CENTC 427 Project Committee. Welcome, sir. I welcome Dr. Brender Sharma. He is the Deputy Director, Directorate of Ayush, Delhi. I also welcome Dr. Subhash Kaushik. He is working in Central Council of Research in Homeopathy as Research Officer, Scientist Grade 4 since December 2013. Hospital in charge of Dr. D.P. Rastogi Central Research Institute, Noida. Welcome, sir. Dr. Monica. Dr. Monica is working as General Secretary of the Association of Homeopathic Doctors of Saxony, Germany. In 2020, started as Treasurer of the German Central Association of Homeopathic Doctors and as Chairman of Homeopathy Foundation of DZBHA. Dr. Andriana, she will call upon the presentees.
Thank you, Dr. Shirin.
So it's 9:30. I think Dr. Louis Stern has not joined, so I can call the second presenter.
Okay. Hi, everybody. This is Dr. Adriana Carrillo speaking. I welcome you to this poster session about experience in cancer and chronic diseases management. We have the participation of Dr. Srishti Mahayan and Dr. Gauri Chawla as session coordinators. Please remember, poster presentations will have 10 minutes for the presenters, and after that, we will have the questions. To start, we invite Dr. Bhaskaran Jagadish with an important topic about an exploratory pilot study, potentized form of chemotherapy to reduce the side effects of chemotherapy medication. Welcome, Doctor.
Dr. Bhaskaran Jagadish.
I'm going to present my little work I did on chemotherapy medications, how to reduce the side effects of chemotherapy drugs by giving potentized form of chemotherapy medicine. This is the topic. Before I start talking about the proper topic, how I got involved in this study, I'm just going to give you a little background. I'm a senior anesthesiologist qualified from UK. And part of my anesthesia training, I got exposure to palliative care and pain management. So where I ended in seeing a lot of advanced cancer patients. So after I come back to my home country in India, I started a little palliative care setup on my own, where we have treated hundreds of terminally ill cancer patients. To look after these patients, I employed a homeopathy doctor as a duty doctor, and we used a lot of his recommendations of choosing a particular drug in reducing the side effects. For example, drugs such as carcinosin, Tuja, Carbovec. He suggested various drugs. Some of them helped, some of them did not help. And when we deal with these patients, we had found three major issues. One is the disease per se, the cancer. Number two, the side effects of the treatment they are getting from the allopathy colleagues, mostly the chemotherapy. Number three, the psychology or the fear factor surrounding cancer as well as the chemotherapy agents. So one day I was accidentally talking to my homeopathic colleague, and he said there is a specific concept called tautopathy, wherein we convert an allopathic drug into potentized form, giving it along with the allopathic drug to reduce the side effects. Then when I said, can we try the same for our cancer sufferers who is taking chemotherapy medications? So that time we had few patients taking two drugs called docetaxel and carboplatin. So we tried it, and to my utter surprise, we find extremely beneficial results straight away. The commonest side effects of chemotherapy is nausea and vomiting, hair loss, extreme fatigue, and organ-specific toxicity. We all know these things happen because the chemotherapy drugs kills the fastly dividing our own body cells. Cancer cells being the most actively dividing cells, these chemotherapy drugs go and destroy the cancer cells. Unfortunately, along with that, they also destroy fastly dividing normal healthy cells such as hair follicle, intestinal mucosa, bone marrow, etc., etc. When we give it the potentized form, as the founder of homeopathy, legend Hahnemann, to our utter surprise, I don't know the exact mechanism how it helps, but these side effects straight away disappeared. Patient's well-being is well preserved. Importantly, there is no nausea and vomiting, and food intake is improved. So by and large, we were really, really surprised. Then onwards, we routinely used it in all our patients. We covered over 75 patients in the last 4.5 years. Of course, we have treated additional about 25 patients before this presentation. So how we started doing it, the methodology, any parent chemotherapy drug, we take about 1 milligram after dissolving it in normal saline, and then 1 milligram of the parent drug available in 1 ml form. We dissolve that in 100 ml clean drinking water. We vigorously shake it for about 10 times, and we wait for 6 hours to wait. And then from that mixture, we give 5 ml of the drug twice a day to our patients, along with full course of chemotherapy. So this similar technique, we used it for all other chemotherapy drugs. And we selected patients, mostly all adult patients, terminally ill patients, patients who are specifically have a good faith in homeopathy and who are willing to be participating in this sort of exploratory study. So we excluded specifically children and patients who are a little reluctant or who don't understand the concept of potentized medication. And in our results, we find almost none of them had 0% nausea and vomiting. And hair loss was there, but it is very much reduced. And fatigue is almost very, very negligible. And diarrhea, constipation is also substantially come down. And none of our patients developed any serious organ toxicity. To our utter surprise, 2 of the patients who are referred to us for palliative chemotherapy totally got their cancer resolved. One of them is a lung cancer, spread to the ribs and local lymph nodes, and completely disappeared. And another one is a colon cancer, spread to the local lymph nodes. An elderly man, they initially thought it is inoperable, but patient subsequently had a good resolution of the tumor without any side effects, so that he is able to undergo a proper resection. And now he's totally cured and he's still very much alive, these 2 patients. So we find in our exploratory study, the potentized form of chemotherapy medications definitely reduces the side effects of chemotherapy medication. And it doesn't seem to interfere with the original chemotherapy treatment. In fact, it seems to be working in a synergistic way. We sent our results to our CCRH in Delhi. Now with CCRH sponsored trial, we are now doing a similar exploratory trial in Apollo Group of Hospital, where I'm working as a senior consultant. And we are supposed to study 30 patients. We have covered about 10 patients. All 10 of them had similarly fantastic results without side effects. I rest my case. I'm happy to take any questions. Thank you.
Thank you. Thank you, Dr. Jagadish. Do you have any questions regarding this abstract from the attendees to Dr. Jagadish?
The abstract I prepared, so I have not much, except that there was a little clerical mistake, but other than that, it's fine. my background is, maybe, you guys are very good with homeopathy and you will ask a lot of questions if it is homeopathy. Since I'm talking about an allopathic concept, bringing into homeopathy, we have covered almost all chemotherapy drugs, about 7 of them. The commonest is docetaxel, paclitaxel, cisplatin, carboplatin, bicasivimab, and various other drugs. And it seems to be work. And when I started it, I was not aware of Jean Bogart, another famous person, a French doctor who has done similar study over thousands of patients. But I was not aware of his original results. But when I get in touch with CCRH in Delhi, they said, the work done by Jean Bogart, and he has done almost similar study.
Can I ask something?
Yes, sir, please.
Dr. Jagdish? Yeah, great. In fact, this is very interesting, and we also done similar studies, and this is fantastic, I would say. I must congratulate you for this work. Did you say that you tried to test this against cancer to see whether it can have some regression?
Yes, I mean, not on its own. But as I keep saying, the chemotherapy we employ in 3 strategies. One is palliative chemotherapy, which is advanced cancer where the cure is very rare, and another one is neoadjuvant. Before they do surgery, they give chemotherapy to reduce the size of the tumor, and then they do surgery. The third one is post-operative chemotherapy to kill the microcancer deposits. Whereas in the palliative chemotherapy, because I run a palliative care center, 2 patients who got admitted there, they're given only 6 months or 9 months to live. With this combination, I find their tumor regressed so much. One of them is completely cured, lung cancer, and another one is colonic cancer, which was unoperable and a lot of spread. Resolved so much, the patient underwent colectomy, and he's still alive. He's about 88 now. He had this issue about 84, when he was 84. So yes, it regresses the cancer very much. I haven't tried it.
Okay.
Just this drug alone, potentized drug alone, along with full course of chemotherapy. Yes.
Great.
What I mean is intravenous drug. Yeah.
Oh, okay. And and you must have repeated the potencies in 2 or 3 times in a day.
I use one.
How did you repeat?
Yeah, 1C potency I've given twice a day.
Oh, okay. Thank you.
Thank you.
And
Thank you.
Dr. Subhash Kaushik, sir, do you have anything to ask? Dr. Subhash Kaushik?
Thank you, Dr. Jagdish. Congratulations. I think you have done adjuvant homeopathy along with your chemotherapy. That's fine. Twice a day.
Thank you, sir.
Great job. No issue.
Thank you, sir. Thank you.
Dr. Adriana can call the next.
Thank you.
Thank you, Dr. Jagadish. So we are going to continue with the next presentation with Dr. Pirabin. The title of the abstract is Unique Cure of Parotid Adenoma, a case report.
Shall I share the screen?
Yeah, Dr. MSI or Praveen, he'll be presenting it.
Good evening, everyone present here. I'm going to talk about present a case of unique cure of parotid adenoma, a case report. First, it is a case of parotid adenoma. What is parotid tumor? It is present as a film swelling at the temporomandibular joint as a parotid gland tumor. The commonest tumor is mostly adenoma, specifically a pleomorphic adenoma, according to the histological study. This is a slow-growing, painless, and asymptomatic tumor. So USG is the most common investigation to rule out the parotid gland mass, as well as the morphological and structural changes. In USG, the neoplasm may present as a hypoechoic features. So the traditional treatment is only parotidectomy, with high risk of complications such as injury, infection, and nerve damage. So there is high chance of recurrence after surgery in traditional treatment. So this is a case of parotid adenoma, which is completely disappeared even after homeopathic treatment with follow-up more than 8 years. There is no recurrence. So this is a case came to our OPD, National Institute of Homeopathy, Kolkata, with film swelling over the left temporomandibular joint, existing for 1 year with no pain no burning or any other symptoms. So on examination, the patient presents with 2 mm diameter of a swelling, which is firm in consistency and smooth surfaced. It is free from the skin, but it is fixed with the underlying structures. So the swelling was present as small in onset, but it was increased gradually in size. So he took homeopathic treatment for more than 6 months, but there is no improvement. So after coming to OPD, after thorough case taking and considering the mental generals, physical and particular, we recorded the cases and totality of symptoms was found. That are which was the swelling in the left temporomandibular joint. The thermal of the patient was the heart, and he has marked desire for meat, salty food, and chili, and he was this aversion for bitter things. And the perspiration of him was very profuse and offensive. And there is underfreshing sleep, and the patient was irritable, extrovert, and want selected company. These are the totality of symptoms of the patient. So according to the symptoms of the patient, the case is predominantly of psoriatic miasm. It was analyzed miasmatically. So after considering the symptom, the repatriation was done, and according to the repatriation through radar, there were top medicines with highest symptom and highest rate, which was found to be sulfur, causticum, phosphorus, lacasis, nitric acid, and naxometer. So according to the miasmatic analysis, repatriation, and totality, lacasis was selected due to the predominant left side affection, and there is literature of homeopathy which shows a marked affinity towards lacasis on left-sided parotid gland. And Herring also said about the threatened abscess of parotid gland, and there is also mumps, especially on the left side. So according to that, lacasis was given in millisievert potency from 0/1 to 0/4 or followed up to 4 months. After 0/4, the swelling was reduced lightly and the patient was better overall. But there was a recurrence of appearance of new symptoms, that was a warty growth on the tip of the nose. So according to the new symptom, causticum was selected, due to which the causticum follows lacasis very well, and it has the highest grade medicine in repertory of warts on the nose, especially causticum. And it is antipsoric, as well as it has the marked affection on the tumor of the back behind the ear. So causticum was given in a millisievert potency from 0/1 to 0/6 for the next 6 months. The wart was completely reduced, as well as the swelling was reduced remarkably. So after that, in the further course of the treatment, there was a new symptom of cystic swelling on the wrist joint, especially on the right wrist joint, and also development of tingling in the legs and desire for chilies and development of hypertension. Based on the totality, Silesia was selected, which was mainly follows causticum very well, as well as it is mainly has the action of glandular structure, especially swelling of parotid and induration of the parotid gland. So Silesia was given in 0/1 potency, and in the further course of the treatment, there was a marked reduction of swelling up to 60 to 65%. So that the USG was done after that. Before that, the USG was not done due to the financial crisis and unwillingness of the patient. So in our institute, the USG was done. There was a space occupying lesion in the left parotid area while USG. So after the continuation of the medicine of Silesia, the total parotid gland was dissipated completely without any recurrence, and the ganglion was also reduced. So this is a case which shows that there was no recurrence of the parotid adenoma even after complete disappearance of the parotid swelling. So this case is the evidence-based case study. That's very important because, especially in the literature of medicine as well as homeopathy, despite of flaw of lacking the histological confirmation of this case report may inspire for systemized research in homeopathy on pleomorphic or other adenomas of parotid glands. Thank you.
Any questions, Dr. Subhash Kaushik?
I think I am fine, but as he mentioned that lacusse is 0/4 in 4 months plus causticum 0/6 in 6 months. So what was the pattern of giving the medicine?
Actually, pattern of giving medicine is like 0/1, 16 dose in alternate days in 1 month. 16 dose.
Okay, it's fine.
Yes, thanks.
Yeah, can I ask something?
Yes, sir. Yes, sir.
Doctor, yeah, I think this was a very impressive result that you got, and you must
Yes,
be
sir.
congratulated for that.
Thank you, sir.
I just wanted to confirm that whether you established a diagnosis with the help of histopathology study or biopsy.
No, sir. Actually, it is a government hospital, and the patient was poor, very poor. So we can't do that actually at the time. So there was no facility in hospital also. So we done only USG after the treatment, and during the treatment, not before the treatment.
So how did you conclude the diagnosis of malignancy?
Mainly on the basis of the clinically only, sir. Like, and also an USG shows a space occupying lesion there, and it is a film and a non-symptomatic tumor. So it was considered as a pleomorphic adenoma. It was mostly 80% of the incidence.
Okay. So do you think it was a malignant tumor or it was a benign tumor?
Benign tumor, sir.
It was a benign tumor. Okay, thank you.
Thanks. Thanks.
Dr. Brender Sharma, sir, do you have any questions?
Actually, in your study, you have concluded only the benign nature of the tumor.
Yes,
And there is no fact that any, you can say, histopathological examination is there to ascertain whether the case was towards the malignancy or it was in between the benign and malignant. Anyhow, you have diagnosed as a benign and your results are excellent. So no doubt, congratulations to you for this achievement. But
Yes,
in future, there should be a scientific evidence regarding our, you can say, such type of topics, because
Yes.
we can't enter into the scientific field unless until we have any investigations. So
Yes, sir.
anyhow, you have done a good result. Thank you.
Yes, sir. Thank you, sir.
Thank you, sir. Adriana, you can call upon the next person.
Okay. We invite Dr. Mini Mehta to present your abstract, which is titled Homeopathy in Cancer Care.
So I work as a palliative care physician in one of the biggest cancer hospital in Delhi, that is Rajiv Gandhi Cancer Hospital and Research Institute. Here I have joined as a homeopathic palliative care physician. Here I get patients, the dying patients who are even done with morphine or who are intolerant to the chemo or radiation. When they stop it, then I get the patients. So it's been a year that I'm working here, and I have seen very, very good results in patients post chemo and radiotherapy, and where I was able to make with simple constitutional medicines and their complementary medicines, and rarely I had to use any mother tinctures. So I found that homeopathy is very efficient palliative. It is the best, the most wanted palliative care medicine, where symptomatic treatment works like magic to the patients. So here I have till now treated 50 cancer patients who were under conventional treatment, who were treated with chemo and radiotherapy. And later on, when their pain, they had painkillers, they were having morphine, and still they were not getting better. So I got those patients and I treated them with homeopathy. So basically, the problems faced by cancer patients are pain, open wound, they're non-healing, because chemo affects a lot of your wound healing, breathlessness, systemic inflammation, gastric disturbances, and bleeding, and insomnia and anxiety, death frights, and other symptoms. So here I would like to present 3 cases here. The first case he was a person, 62-year-old male, and he was having metastatic cancer of larynx. left vallecula. And after chemo also, there was a lump on the side of the neck, which was not going. And he was suffering with hiccups, constant aggravated at night. And from past few days, he was having constriction sensation in throat on lying down, dryness of mouth, swelling on the left side of neck, difficult swallowing, with severe stitching pain in the left side of the throat, pain in left upper limb extending to the left occipital area. So I gave him his constitutional remedy. I gave him Lacasis 30 in 100 ml of water, and I told him to take 4 hourly. And he was feeling much relief in the pain during swallowing, and his hiccups were stopped. And we continued this medicine only. Then we went on to 200. And after a few weeks only, we could see that there was no lump on the side of the neck. And while he was taking my treatment, he was not on chemo because he was already, the chemo was stopped because there was no benefit. And because of his age, they gave him a 3 months break. But he got rid of this lump in the neck. And still they are finding nobody is giving them any treatment. He is on break and on my medicines. And then he'll get a PET scan done and they'll see what they will do. So here I could see it was like magic, and these people are now sending me patients. And the second case is a case of a lady who was a known case of cancer left lateral border of tongue, and that it was, a surgery was done, and post radio she was having severe mucositis and dysphagia. She was crying every time in spite of all the painkillers, morphine. Even she tried acupuncture. Her life was hell. She could not swallow. She had a nasal, feeding tube also, but still could not take food. After just, 5-7 days of the treatment, she was much well. That next, after 7-8 days, she came back and she got her tubes, this Riles tube removed, nasal tube, feeding tube. Here, this lady, I gave her Nux Vomica 30. All the symptoms were indicating towards the Nux Vomica 30, and she was better. And after that, when she came to me, then I took, entire case taking, and then I found that she needs sepia, and she was a sepia lady. I gave her sepia 203 doses, and she kept really well after that. And she comes every, month to collect her medicine, and she's fine. And the results were magical. Then the third case I want to present here, this was the case of a patient who was in real pain when he came to me. His cancer was advanced and there was lot of swelling on his face, and his wound was really bad, poisonous wound, smelling like hell. The wound was very offensive, non-healing, and he was very hopeless when he came to me. But after taking he was taking morphine, 3 to 4 times a day. But when the patient comes to me, I just ask about the modalities of the complaint. So that time I gave her Nux Vomica 30, and I would like to say I have given him Nux Vomica 30 to inhale also, through olfaction. I made it in a vial, and also I made it in 100 ml because I wanted to help him every way. Then his pains were better, and then he came back to me, and I took the entire case, and the case was indicating towards the constitutional remedy Cocculus indicus, because he told me that while traveling he feels a lot of nausea since beginning, and when at the night he wakes to eat something, he walks very slowly and he don't want to disturb his children. He's worried about them. So when I gave him Cocculus, Nux Vomica, Hydrestis scan, I gave him, his wound started healing, wound started to heal. And what happened when the wound started to heal, he started developing some eruptions in the entire body, and itching was there. So he was constantly, visiting his cancer doctors also, oncologists also. He referred him to some skin specialist who gave him steroids. And after taking those steroids and those things, one day he had bleeding through vomiting, and he died. But for these 6 weeks, he was so well that he told me, ma'am, I'm not taking any morphine, only 1 or 2 Ultrasets sometimes I have to take. If this will go like this, I will be, able to join my job back.
Okay,
So
Dr.
similarly,
sorry to interrupt, but your time is up. Please conclude.
This way, a lot of cases have come and they all have improved. And I have given the results. I have shown the results, like how much, I don't know when my screen's not coming clear. That sleep, gastric problems, most of the patient pain and inflammation is the main area where we can work magical with homeopathic remedies. And I'm very happy to see what I could do in this sphere. So I thought of presenting this. Homeopathy is very, 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 very effective in this pain and palliation work. Thank you very much.
That was really good. Dr. Subhash Kaushik, please, if you have any questions.
I think it's fine. I have some issues about the medicine prescribing because Dr. Mini is saying she has given Lacasis 30 in 100 ml first day and she started Lacasis 200 from the second day.
No, not from the second day.
Okay.
Not from the second day. Week to week, second time, second visit.
Okay. Fine.
Yes, sir.
Then it's okay.
Dr. Brenda Sharma, sir, do you have anything?
She has presented 3 cases, and in all cases, I think one is the commonest, that is the Nux. And whenever she finds that in second case, she told that after Nux, that was the patient of sepia. But Nux has given the relief. So I want to ask that what is their miracle in all 3 cases that Nux has done?
Can you hear me, sir?
Yes, Dr. Mini.
Sir, I have seen in most of the patients who are already taking morphine and painkillers and going through radiotherapy, I find that they all tell me when I ask them about when the patient has come in pain, I cannot take a big case study. I have to judge what he's portraying. So that time when I take the modalities, everybody, most of the patients indicate me towards nux vomica symptom that this is pain, they are irritable. And they say that whenever people talk, it increases with the sound in the surroundings. So there are people who are relieved with belladonna also, but mostly people, first of all, I have to give them nux vomica because already they are taking a lot of things. I think it antidotes that. And their nerves are irritated.
Here, this is the point which I want to indicate that when you start any treatment with the Nux, that has a basic, you can say, baseline for the treatment, and all that makes the basis for the selections of other remedies also. So thank you very much.
Thank you.
So just before we conclude, just Dr. Mini. Dr. Mini.
Yes, sir.
So I have seen your poster. Kindly, first of all, hide the identity of the patient. Still, that photo in photograph, patient's face and all those things are very much
I could
visible.
not show the swelling, that's why.
So kindly do that. Number 1. Number 2, in scientific things, you should try to always analyze the exact precise outcome that we could produce. And instead of just saying miraculous and sweeping statement, these things we should not mention in our presentations. Okay? And try to analyze as we said you in our comments also, present considering home care guidelines. Have you gone through those guidelines? So please see that and try to do critical review whenever we get better result instead of just making sweeping statement. Okay? So thank you for participation.
Thank you, sir. Dr. Adriana, the next presenter.
Thank you, Dr. Mini. Now we're going to invite Dr. Mohit, who is going to present his abstract about pituitary microadenoma treated with individualized homeopathic medicine. Welcome, doctor.
Hello everyone. Hello friends. So today I'm going to discuss about a very interesting case of a pituitary microadenoma treated with individualized homeopathic medicine. Now, first of all, what is pituitary adenoma? So pituitary adenoma are common benign tumors of pituitary, and they have an overall prevalence of 16.7%. Now, historically, these tumors were classified on the basis of their size as microadenoma or macroadenoma, and also on the basis of the hormones they secrete. For example, prolactin secreting adenoma or ACTH secreting adenoma, etc., etc. Now, in 2017, the WHO classification of pituitary adenoma was revised, and now these tumors are classified on the basis of the pituitary cell lineage instead of the hormone they produce. Now, this case study is a pioneering study on functional lactotrope microadenoma and responding to individualized homeopathic treatment, and it is accessible on PubMed database. Now, this study is about a 44-year-old female who presented with following symptoms. These are recurrent episodes of headache in frontal and vertex region, and these headaches were precipitated from mental stress and after bouts of anger. Second, there was paresthesia in left leg. She had dimness of vision, and lately she also complained of formation of large offensive clinkers in nostrils. Now, MRI of brain and serum prolactin levels were done, and they confirmed that she had a functional lactotrope microadenoma, that is a pituitary adenoma which is secreting prolactin. And you can see I have shared MRI slides also. You can see the left pic where the pituitary adenoma can be seen as a hypointense lesion on the right half of anterior pituitary. The white arrow can be is pointing towards that lesion. Okay, so surgical resection of this tumor was attempted, but surgery was unsuccessful as there was heavy intracellular hemorrhage. Now, during the post-surgical period, she developed hyponatremia and remained subconscious for some time. Now, after the surgery, almost all of her symptoms, especially the headache, worsened, and she also started developing large offensive clinkers in the nostril. And it is at this stage she consulted us for homeopathic treatment. So we examined the patient, and on examination, we didn't find any neurological deficit resulting from the tumor. And we also analyzed the symptoms of the patient and to identify the patient-specific symptom or the characteristic symptom. And we finally repertorized the case with the help of synthesis repertory. And these are the rubrics we selected. And these are generals, loss, blood off, head pain, loss of fluids, head pain, anger from, extremities, numbness, lower limb, left. And on the basis of repertorial analysis, phosphorus was selected, and this medicine was prescribed for 10 months in increasing potency. We used the centesimal potency, and during homeopathic treatment, there was marked reduction in the frequency of headache and other symptoms. And MRI was repeated twice during the homeopathic treatment, and you can see the after treatment MRI, which is a contrast enhanced MRI. And in the coronal section, you can see the pituitary showing a uniform homogeneous signal intensity, which is normal. And after homeopathic treatment, we also tried to establish the cause-effect relationship using the modified Naranjo criteria. And I have shown the details of the Naranjo criteria, and the score was +10. And based on the modified Naranjo criteria score, it can be concluded that there is some evidence to attribute a causal link between the treatment and the clinical improvement in this patient. Now, there were two notable points in this case study. First was that this study reaffirms the previous epidemiological finding of tendency towards more headache among cases of lactotrope adenoma who had pituitary hemorrhage. And second was that the hemorrhagic complication with which this patient developed and the subsequent worsening of the headache were also the guiding symptoms for the selection of phosphorus. Now, what this indicates is that these symptoms, which form the totality, were not randomly associated. And it is possible that there was some underlying mechanism, some underlying pathological mechanism relating these symptoms. And it is important to explore these underlying mechanisms in order to have a better understanding of concept of totality of symptoms. In the conclusion, I would like to say the case studies suggest that individualized homeopathic treatment can be helpful in pituitary adenoma with increased risk of complication such as intracellular hemorrhage. The finding of this case study merits a more rigorous trial to test efficacy of individualized homeopathic treatment in cases of pituitary adenoma. Thank you.
Thank you, Dr. Mohit, for your presentation. Dr. Brender or Dr. or another
Subhash.
Subhash, Dr.
Yes.
Subhash.
If you have any questions, sir. Yes, sir.
Dr. Mohit has presented a perfect case with the scientific evidence, and I think it shall be the ideal case for presentation, and he has stressed especially for the individualization, which is the basic concept of homeopathy. Thank you, Dr. Mohit.
Thank you, sir.
Yes, because it is based on the Naranjo criteria, so it's fine. Thank you. Thank you, Dr. Mohit.
Thank you, sir.
If I just, Dr. Mohit, good case,
Yes,
I
sir,
think
please.
well documented case. If you could also mention the potency and repetition, that will help the viewers and the participants
Yes, sir.
when you do a talk.
Yes, sir. When we prescribed the phosphorus, we started with the 200 potency, 200 centesimal potency, and then we move further to 1M and 10M potency. Sir, we have only prescribed in centesimal potency because we are working in Nehru Homeopathic Medical College, and we are supposed to prescribe drugs which are mentioned in essential drug list. And in our EDL, only centesimal potencies are there. Drugs in centesimal potencies are there. So we moved
the
up till
repetition.
the 10. Yes. Yeah, repetition, when we prescribed in 200, single dose used to be given in a day, and 3 consecutive doses of phosphorus 200. When phosphorus 1M was prescribed, we used to wait for 1 week before repeating before prescribing the second dose of phosphorus 1M. And we gradually raised the potency to 10M.
Okay, thank you.
Adriana, the next speaker.
Thank you. We invite Dr. Nisha for the next presentation. The topic is homeopathic in post-surgical invasive ductal carcinoma of breast, a case report. Welcome, Dr. Nisha.
Good evening, all dignitaries. Here is my case report on homeopathy in post-surgical invasive ductal carcinoma of breast. You know, breast cancer has ranked #1 cancer among Indian females with an age-adjusted rate as high as 25.8 per 1 lakh women and mortality of 12.7 per 1 lakh women. Actually, the number of cases of CA breast is ever increasing since 1970s, maybe because of the changes in lifestyle. Actually, the terminology for the most common type of breast cancer has changed from invasive ductal carcinoma, not otherwise specified, to invasive carcinoma of no special type. Among them, the most problematic one, that is a triple negative variety, in which we get the estrogen response negative, the progesterone response negative, and human epidermal growth factor not overexpressed. That is the most dangerous one because of its aggressive nature and a lack of targeted therapies, leaving chemotherapy as the mainstay of treatment. My aim is to show the utility of homeopathic treatment in post-surgical carcinoma cases. Here is a case of 74-year-old female presented with pain and edema of upper arm, right upper arm, 1 month after modified radical mastectomy of right breast, who was diagnosed with triple negative variety of invasive ductal carcinoma of stage 3A. And the patient was having a strong family history of cancer, especially in her late father, who was having colon cancer, and also her 2 elder sisters were having breast cancer. And she has diminished appetite, desire for sweets, and aversion to milk. And she was very affectionate, industrious and sad stories affected her profoundly, and all her vitals were normal. And after a detailed case taking and repetization, I have found Calcarea carbonicum as a single individualized remedy, and it was given in 200 C potency, and it was given like it was repeated every 2 weeks, single dose every 2 weeks. And also, as it is a triple negative disease with poor prognosis, I have also given Phytolacca decandra 200C as a specific remedy for breast cancer, and it was given like 3 pills twice daily. And the pain assessment was done using visual analog scale, VAS score, which showed good improvement, and the quality of life was also assessed using the validated questionnaire by WHO. And the clinical outcome was also analyzed, the changes in the clinical picture, and also CT thorax was done to compare the clinical outcome. And the results was like that the patient had shown much improvement with betterment in quality of life, even after not following the conventional post-surgical adjuvant therapies. Only following out medicines, she had showed a good improvement. And the pain assessment that was done using visual analog scale, which showed good improvement from a score of 8 to 1. And the quality of life was also improved. She was able to do her day-to-day activities very easier. And the CT thorax was also done to show the changes in the clinical picture. It showed almost all normal findings. With all the lung fields were normal. There was no evidence of metastasis in both ribs and vertebrae, and also no mediastinal lymphadenopathy was noted. And the quality of life was also improved. And my conclusion is that being an aggressive variety with a poor prognosis, triple negative breast cancers are some challenges regarding the treatment, and research is ongoing to develop better systemic treatments for such a condition. We know homeopathy treats patients, not just symptoms. So we can consider homeopathy as an alternative for post-surgical adjuvant therapies also. That's all. Thank you.
Thank you, Dr. Nisha.
Thank you, ma'am.
That was a well-presented case. Okay, Dr. Brenda Sharma, sir.
Yeah. Dr. Nisha, please let me know what was the basis of your prescription for Phytolacca. It was only on the basis of diagnosis or having some symptoms?
Sir, I think Phytolacca is a very good remedy for cancer breast. We can consider it as a specific remedy for CA breast with the hardened feelings, swollen sensation, and all. That's why I have prescribed Phytolacca also as a specific remedy for triple negative breast cancers.
And you were not confident with the Calcarea carb?
No, sir. Actually, it's a triple negative variety with poor prognosis. That's why I have given Phytolacca as a supplementary medicine also, along with the constitutional medicine Calcarea carb.
Okay, thank you.
Dr. Subhash Kaushik, sir.
Yes, Dr. Nisha, I just missed the duration of your treatment because you have given Phytolacca 200 BD for how many days?
Sir, it was given for about 6 months actually.
My goodness,
Yes.
200 BD for 6 months.
Yes, yes.
And Calcarea carb 200 you are repeating every fortnightly.
Yes, it was repeated in an interval of 2 weeks, sir.
So have you reduced the doses when you saw this improvement in the case? Because 200 BD for 6 months is a very high dose according to the homeopathic principles.
Okay, sir. But actually, my plan was, as it is a palliative case, we have to give relief to the patient, right?
Definitely.
That's why I repeated for that period.
Because on VAS score, you are coming 8 patient. Your patient was coming 8 to 1.
8 to 1. Yes, sir.
So,
yes, sir.
When you started at 8 and it was 5 or 4 or 3, so
yes, yes.
have you any planning to reduce the doses or no?
It was reducing like that within that period of 6 months, sir. That pain, it was relieved within that six months period to a score of 1.
Okay, that is fine. But that you will get 4 or 5 figure or 3 figure or 2 figure after 2 months or 3 months. No, or after 6 months you get 8 to 1. This was the score.
Yes, sir. Not. It was like the 8 score was reduced to 5 within a 2 months period. Then
Yes.
it was kept on like that. But after 4 months, again it is reduced, and after 6 months, I got almost relief for the pain.
But
With
your
a score
repetition of 200 was the same. When
yes,
the
yes,
patient,
sir.
when
I
the
haven't
score was
changed.
5 or 4, but you are repeating the medicines twice a day.
Yes, sir. The Phytolacca was given twice a day, but Calcarea was given within an interval of 2 weeks.
That is the fine.
Okay.
So there was no correlation of the medicine repetition and the less scoring. No.
Yes,
Any
sir.
justification for that?
Sir, actually the pain from the starting, that was 8.
Yes.
The patient was having severe pain, and it was reduced within a period of 2 months actually.
Yes.
To 5. Then after 6 months, it got 1. The score of 1.
But after 4 months or 2 months, it reduced to 4 now. But you are still repeating 200 BD. Any specific reason for that?
Yeah, sir, my concern was that not to cause any metastasis or spread of the disease, and I have confirmed it by the CT scan.
Okay. When you have repeated the CT scan?
Sir, after 6 months, I had taken CT scan. Okay.
Thank you.
Adriana, next.
Yes. We invite our next presenter, Dr. Reddy Malesh, who is going to present a case report with his follow-up of infiltrating ductal carcinoma managed with individualized homeopathic treatment. Welcome, doctor.
So hello everyone, respected dignitaries and the experts present over here. This is Dr. Malesh Reddy. This is a poster presentation of a case report. I'm presenting a case report here of infiltrating ductal carcinoma managed with individualized homeopathic treatment with its follow-up. I'm not telling that this is a cure, and we managed the case with the proper documentation. And as you already know, everyone, there is nothing to do because a lot of cancer cases coming to homeopaths for the disease itself and the complications of the disease or the treatment. So here, infiltrating ductal carcinoma case, this is the most common malignancy out of the histological types, and this is having the worst prognosis in the patient. And here, in this case of our patient belongs to this histopathological category of infiltrating or invasive ductal carcinoma or of no special type. So this patient of 48 years old, when you see the patient information, she is of 48 years old when she attended to us, the National Institute of Homeopathy, outpatient department. So that time she presented to us with a swelling, with a 5 centimeter swelling in her left breast, and there was a burning sensation in the left breast. She also presented to us with menopausal symptoms like hot flushes all over the body, where she was having profuse perspiration and burning palms and soles. So that time she was advised to go for surgery for her breast cancer and the treatment, but she was not agreed with the treatment protocol, and she attended us. So we examined the case with the presenting complaint. We examined the case. So the tumor was a 5 into 4 centimeter tumor clinically, and it was clinically a malignancy. While treatment, we considered the homeopathic perspective. So it was a left-sided affection the menopausal stage, and there were symptoms related to the menopause, like burning in the left breast, palms and soles burning, hot flushes with profuse perspiration. The mental generals were considered. She was very loquacious. She was having some weeping disposition. She was irritable, and she was religious. The case was prepared on basis on home case guidelines. So the treatment line was more than 37 months. So it was more than 3-year follow-up I'm presenting here. So initially, the initial ultrasound, when she presented to us, so it was a 47 into 35 millimeters space occupying lesion in the left breast. So it is an almost T4 tumor, and it was TNM staging was stage 3B. FNEC concluded the case as an infiltrating ductal carcinoma or invasive ductal carcinoma. So other parameters we assessed, like the tumor marker, it was 30.8 the moment. The quality of life score assessed using a questionnaire, that is a breast cancer quality of life questionnaire, it was 25 out of 100. So basing on the repertorial totality, and radar 10 software was used. So we got a group of drugs, but ultimately concerning the materia medica and etc., the patient. So lacosis, a single medicine lacosis was given in a 50 millismol potency. The repetition was, daily dose, OD dose. For 32 days, we gave the drug. And for 3 years, we continued the drug. A single medicine was continued, no extra medicine was given to the case. And every month, we were examining the case. Every month, clinically, we did examination for 3 years. And we increased the potency sometimes, and basing on the improvement, we continued the same potency, but sometimes we increased the dose also and potency also. So during the follow-up and outcome, so we found the ultrasonography reports. So it was reduced. The tumor size was reduced in the second ultrasound. It was initially 47 millimeter into 35 millimeter, and later it was only 17 millimeter. Like it was a 2T2 SOL from T4 to T2 tumor. A few subcentric lymph nodes were present, but they were not enlarged. So after the third follow, the third ultrasonography during the treatment, so it was a 27 millimeter, slight increase than the previous, but it is still less than the initial size. The tumor marker was reduced, like it was 30 in the beginning, 30.8 in the beginning units per ml, and later it was 28.7 and 26.6 now. We know that the tumor marker CA15-3 is most commonly used, and this indicates a prognosis for the patient. Slight increase also indicates the worst prognosis in the case. The quality of life improved in this case significantly using the questionnaire. It was 25 in the beginning, and later it was 12, and it was 4 now. Lower the score, the better will be the patient. You can see the graph here. Like I think you can see the graph here. So this is the red, the blue indicates the reduction in the tumor marker value, and this in the green indicates the reduction in the quality of life score, which shows improvement in the case. So this case report is of 3 years of a very dangerous malignancy among females. We tried to show the improvement in the tumor marker, and the quality of life of the patient using a single drug based on the individualization approach. And this definitely illustrates an objective 3 parameters, means this case illustrates the use of objective parameters. And I can say this presentation is one of the rare presentations where you have 3 parameters documented in a single case on the tumor marker, on the tumor itself, and the quality of life. The patient did not go anywhere during the treatment. She did not need any surgery, chemotherapy, or radiotherapy. I would like to thank the consultant oncologist under whom the work was done, and the co-authors for helping me in this case. These are my references for this case, and you can correspond me if there is any doubt regarding the presentation. Thank you.
Thank you, Dr. Reddy, for this important presentation. I don't know if Dr. Brender or Dr. Subhash has questions.
I think it is a very well documented case with evidence based. And as you mentioned, Dr. Malesh, that it include tumor marker and quality of life score and tumor size, and a follow-up for 3 years. So it's nice. Congratulations.
Yes. Thank you, sir.
Thank you, sir. Dr. Brenda Sharma, please.
Yeah, Dr. Milesh.
Yes, sir.
I think we have relied on a single medicine and
Yes.
at least for 3 years. So how much you were confident regarding the better effects of the medicine, even follow up with the 3 years?
Sir, we examined the case every month, the patient with us for 3 years, and we examined the case clinically and with the documentation also. So we saw improvement in the case, sir. So that's why we got confidence that the patient will improve on the single medicine. That's why we did not change any medicine and we continued the medicine for 3 years.
So I salute to the patience of the patient and the patience of the doctor for this case. Thank you.
Thank you very much, sir.
That's a nice way to conclude. Adriana, the next presenter.
No, it's Dr. Nisha. Dr. Nisha. That was the last one.
Yeah, next, do you want me to announce? Dr. Swarupa. Dr. Swarupa Giridhar Patil. On the topic, miasmatic approach to the treatment of one-sided disease, a case report.
This presentation is a report of the miasmatic approach to the treatment of one-sided disease. And the case here was of plantar warts or verruca plantaris. Now, according to the homeopathic literature and research, there are a number of homeopathic remedies for the treatment of warts, which are selected on the basis of totality of symptoms. But this case has presented as one-sided disease, that is with few complaints. So he was a patient of 32 years, male, and who has come with plantar warts of 2 years duration on his left sole. And the lesion was dry, there was no itching, no bleeding, it was painless with gradual increase in the size and number of warts. And he had taken conventional treatment of local application for a year without any improvement, and he has stopped it since last 3 months. So in the past, during childhood, he had some patches of itching skin lesion, and which again he was treated with some local application. Now he had no problem with it. And he had increased perspiration on his soles. So on the clinical findings, that is local examination, we found that these warts, they were zagged, raised, flesh colored, there was no bleeding, it was 38 into 20 mm in size, and they were too small, that is less than 5 mm size satellite warts on this left sole. So now there were very few symptoms here, and on this we diagnosed the type of disease as one-sided disease of external type, that is a local malady, and the miasmatic diagnosis was made of psychosis. Now, since there was no many symptoms for the selection of similimum, for the first prescription, we have given preference to the miasmatic diagnosis of that is psychosis, along with the chief complaint, and also the increased sweating on the soles. So nitric acid was selected, and it was prescribed in 30 C potency, daily 1 dose. And this was later followed, that is after 3 months, by causticum 30 C, depending on the new totality. Now, both these medicines, of course, they were from the SPL company, and they were presented in given in globule form of 30 size. No external application was prescribed, and the patient was advised to keep his feet dipped in warm salt water for 10 minutes daily. This was mainly for hygienic reasons. Now, the follow-up was on monthly basis. Now, for the first 2 follow-ups, the patient, it was with nitric acid 30 C, it was uneventful. There was hardly any change. Then for the third follow-up, the patient came with 2 small warts, that is less than 2 mm size, on his right index finger. And so the medicine was then changed to causticum 30 C, daily 1 dose. Over the next 2 months, there was a marked reduction in the size of warts, and slowly there was also a disappearance of the complaints. And his old skin complaints of childhood, they had returned back, and he was prescribed placebo. So by the end of 7 months, the patient was free of his complaints. So here we can see before treatment, this was the warts he has come, and here there were the 2 satellite warts. Then during the 3rd follow-up, he has come with 2 small warts on his right index finger. And there was no change, much change in his original complaints. Then during the 4th follow-up, that is when he had come with this new warts, we had given him causticum 30C. And after that, during the 4th follow-up, we see that the symptoms had started reducing, and even the warts on his index finger had gone. And later, this is after treatment, there was a complete reduction of his symptoms. So Hahnemann in his Organon of Medicine has given precise instructions about treatment of one-sided disease. He has said that we have to select a partially similar remedy because of lack of symptoms. So here the partially selected remedy was based on miasm, that is psychosis. And again, if you refer to Dr. Hahnemann's chronic disease, he has given 2 remedies, that is nitric acid and thuja, for the treatment of psychosis. So now in this above case, the increased sweating on soles was a deciding symptom between the 2 remedies, that is nitric acid and thuja, and nitric acid was selected. And this remedy has acted as a partially similar remedy. It has given rise to the accessory symptoms, that is the warts on the right index finger. And depending on this accessory symptoms, we have selected the next medicine, that is causticum 30C, which has caused disappearance of his complaints. So here the first prescription was mainly based on it was an anti-miasmatic, and it has opened up the case, and it has given rise to accessory symptoms which helped us to form the totality. Now there could be a doubt whether it was a spontaneous resolution of warts, and this is ruled out by the fact that the duration of the complaints, then no improvement even with conventional line of treatment for more than a year, and also appearance of new symptoms during the treatment. And the effect of salt water, this also could be explored further, but here the return of the old skin complaint, that is during his childhood what he had come back. So this confirms that our medicines have acted curatively. So the take-home message here is that if there are no symptoms, to make the very few symptoms to make the selection of similimum, the prescription can be made on miasmatic diagnosis. And also the local maladies can be treated satisfactorily without any external application. As Hahnemann has told, there is no need of any external application. So thank you. And I would like to thank the principal of KLE Homeopathic Medical College, Dr. M.A. Uchankar sir, for his support. Thank you. Thank you all.
Thank you, Dr. Swarupa. That was a really good case and clearly explained. Okay, Dr. Subhash Kaushik, sir, do you have anything to ask?
I think it's self-explanatory, so nothing is to be asked. It's fine. Congratulations.
Thank you, sir.
Dr. Brender Sharma.
In this case, I think we can conclude that warts and stones are the milestone of homeopathy. He has done a wonderful job. Thank you very much.
Thank you, sir.
Thank you, sir. So I call upon Dr. Priyanka Mangotra. Next presentation for your presentation, Dr. Priyanka.
First of all, thank you so much for giving me this golden opportunity to present at this global platform. So topic of my presentation is clinical verification of the condition where 2 dissimilar diseases meet together in human being, where the new one is the stronger. This is an attempt to clinically verify what we have read in literature. Like according to Organon of Medicine, there are 3 different cases that occurs in nature when 2 dissimilar natural diseases meet together in one person. The first condition is that is mentioned in aphorism 36. If the two dissimilar diseases meeting together in the human being be of equal strength, or still more, if the older one be the stronger, the new disease will be repelled by the old one from the body and not allowed to affect it. And the second condition is mentioned in aphorism 38. That is, the new dissimilar disease is the stronger one. In this case, the disease under which the patient originally labored, being weaker, will be kept back and suspended by the stronger one until the later shall have run its course or been cured and the old one reappears uncured. This is the condition which will be discussed in this case. And the third condition, which is described in Organ of Medicine, that is in aphorism 40, where the new disease, after having long acted on the organism, at length joins the old one that is dissimilar to it and forms with it a complex disease, so that each one of them occupies a particular locality in the organism. So coming to the case summary, on 15 September 2021, a 28-year-old male visited our OPD, hospital OPD, with symptoms of allergic rhinitis. He was suffering from it for 3 to 4 years and had a history of pulmonary tuberculosis 6 to 7 months back. And we got the reports like positive sputum culture and X-ray findings. And he also had completed anti-tubercular treatment. Patient was suffering from allergic rhinitis that we can take it as weaker original disease. But when he contracted pulmonary tuberculosis, a new dissimilar stronger disease, he was completely free from the symptom of allergic rhinitis. But after completing anti-tubercular treatment and almost free from symptoms of pulmonary tuberculosis, like he was suffering from cough with expectoration, fever, etc., he was again started to experience allergic rhinitis symptoms that were periodical nasal block, running nose, sneezing, itching, watery eyes, dust allergies, and he is also having a positive family history of allergy. And after case taking, Solidago 30C was prescribed. 2 doses at 15 days interval was prescribed. That was on basis of totality of observed symptoms that the patient was coming to OPD, and we mostly used boric metramedica, Kent repertory at that time. So in boric metramedica under Solidago, it's mentioned repeated colds or tuberculosis, nasopharyngeal catarrh, thoracic operation, eyes injected, watery, burning, stinging, paroxysmal sneezing, and the most important characteristic what the patient was having, that with these respiratory symptoms or allergic symptoms, he was suffering from difficult and scanty urination. So this symptom was always there. Earlier also when he was not having tuberculosis, and after that also when the allergic rhinitis reappeared. So it was very characteristic, so indicating towards Solidago. And there was a great improvement in the clinical symptoms of allergic rhinitis that was assessed by using SFAR score, that was the score for allergic rhinitis. Post-treatment is what it was 3 as compared to baseline score of 11, as we can see here in the this graph. Like with time, I mentioned the SFAR score. So with this, I want to conclude that this case clinically verifies the case scenario mentioned in Organ of Medicine, where the new dissimilar stronger disease, that is tuberculosis in this case, leads to suspension of the old weaker disease, that was allergic rhinitis, and runs its course or being cured, and the old disease reappears uncured. This is a single observation which can be correlated well with the aphorism. In future, further cases and observations like this are needed to verify Dr. Hahnemann's observations. And what I want to say is, in aphorism 35 also, Dr. Henneman mentioned this, even nature herself is unable to remove a dissimilar disease already present by one that is unhomeopathic, even though it be stronger. And just as little is the unhomeopathic employment of even the strongest medicines ever capable of curing any disease whatsoever. So here, even the tuberculosis was not able to remove the allergic rhinitis from the body, even if it is a stronger disease, because it is dissimilar to it. But after administration of similar homeopathic remedy, there was a significant improvement which clinically verifies the second condition mentioned in the organ of medicine. So thank you so much.
I think, Dr. Priyanka, it's a good case from philosophical point of view, but I don't think is there any correlation between allergic rhinitis and tuberculosis, but philosophical point of view, it's fine. You have to go in depth of the case, whether that patient was suffering from allergic rhinitis prior to that tuberculosis, or was there any correlation between that? Otherwise, from philosophical point of view, it's great. Great job. Great observations.
So Dr. Brenda Sharma, sir.
Yes, Priyanka, in this case, I think you must have a co-reference with the tubercular miasm also, because you have given the reference of tuberculosis, I think, which is not as per the homeopathic philosophy treated with the homeopathic treatment. So can you consider that after taking the complete ATT, there is a removal of tuberculosis or its complications to the other parts of the body? So here we can take the reference of the tubercular miasm for this correlations with these dissimilar diseases of the different natures as per in aphorism number 26, that is the therapeutic law of nature. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir.
Yes, we invite to our last presenter, Dr. José Luis Jiménez Sales from Spain. He's going to talk about la homeopatía en las enfermedades de baja prevalencia. Bienvenido, doctor José Luis Jiménez.
Sorry, I'm not speaking English. I speak Spanish. Excuse me.
Okay.
Está bien, doctor. Está bien.
De aportación de la homeopatía a las enfermedades de baja prevalencia. Las enfermedades de baja prevalencia, definidas como aquellas que se presentan con una incidencia igual o inferior a 5 casos por 10.000 habitantes, se caracterizan por ser enfermedades que suelen tener un diagnóstico definitivo entre los 5 y 10 años de iniciados los primeros síntomas, debido al diferente grado de intensidad y variabilidad en la expresión sintomática de los distintos pacientes y al desconocimiento de la etopatogenia de muchas de ellas. La industria farmacéutica no está interesada en su estudio, dada su baja rentabilidad económica en términos de mercado. En España se calcula que hay unos 3 millones de personas afectadas por las mismas. La Organización Mundial de la Salud calcula una incidencia del 7% de la población mundial. Hay identificadas actualmente unas 7.000 enfermedades de este tipo. El 65% de ellas se consideran crónicas, degenerativas e invalidantes. El desarrollo de déficit motor, sensorial o intelectual se presenta en la mitad de los casos, originando discapacidad de la autonomía personal que conlleva un alto grado de dependencia y sufrimiento individual y familiar. 2 de cada 3 casos comienzan antes de los 2 años de vida. El diagnóstico tardío conlleva falta de tratamientos o tratamientos inadecuados y un peor pronóstico de las mismas. El alto consumo de medicamentos y productos sanitarios, la frecuente necesidad de atención médica, las necesidades de adaptación al transporte, la vivienda y de asistencia personal suponen un alto coste familiar que inciden en la salud y economía general de la familia. En más de la mitad de los casos está en juego el pronóstico vital del paciente. Se produce un 35% de muertes antes del año de diagnosticarla, 10% entre 1 y 5 años y 12% entre los 5 y 15 años. El presente trabajo quiere dar a conocer el proyecto gratuito y solidario que el Grupo de Investigación Proceso Sánchez Ortega de Sevilla ha venido realizando en un convenio de colaboración con con la Federación Española de Enfermedades Raras, que nos proporcionó el contacto con un grupo de pacientes de enfermedades de baja prevalencia con expresión fundamentalmente dermatológica, con la finalidad de facilitar la objetivación de la posible mejora sintomática de la enfermedad con el empleo de medicina homeopática, complementando sus tratamientos de bases habituales y los posibles beneficios derivados. A los pacientes se realizó una historia clínica, incluyendo informes diagnósticos previos y tratamientos pautados, exploración médica general y homeopática por parte del equipo y seguimiento durante un año con arreglo al protocolo diseñado. Toma del caso, individualización del paciente en su expresión característica, individualización medicamentosa con arreglo a la similitud con la totalidad de características recogidas, prescripción homeopática y evaluación periódica hasta el año. A cada paciente se le asignó un médico para hacer un seguimiento médico continuado. Las enfermedades atendidas fueron epidermolisis bullosa, pitiriasis rubra, esclerodermia, xeroderma pigmentosum, enfermedad de BC, porfiria cutánea tarda y una condroplasia. Los medicamentos homeopáticos seleccionados en cada caso individualizado, tras la repertorización, se prescribieron en diluciones homeopáticas 50 milesimales. Las principales cepas que obtuvimos fueron calcárea carbónica, silícea, pulsatilla, sulfur, natrum muriaticum, fósforo y licopodium. Puntualmente en agudizaciones se utilizaron apis melífica, aconitum, arnica montana, belladona, mercurium solubilis y caléndula principalmente. Y se volvía a retomar el tratamiento constitucional de fondo una vez pasada la fase aguda. En cuanto a los resultados, si bien el tiempo de seguimiento fue corto, fue suficiente para objetivar una mejoría asintomática de los pacientes, tanto en el aspecto de sus lesiones, reducción de tamaño y profundidad de úlceras, ampollas, descamaciones y secreciones, así como de los síntomas subjetivos como dolor, picor e impotencia funcional, permitiéndoles una mejor interacción con el medio social y mejoría subjetiva general, confirmándonos que el tratamiento homeopático, basado en la totalidad característica del paciente, mejora integralmente al mismo en su proceso general de reparación, independientemente de la etiología y expresión de la patología atendida. Aunque en la mayoría de los pacientes tratados su enfermedad es crónica, evolutiva y de grave pronóstico, la utilización de la medicina homeopática les permitió reducir el número y cantidad de fármacos antiinflamatorios, antipiréticos, antibióticos, analgésicos, etc., así como del material de curas por poder espaciar estas un poco más. Conclusiones. ¿Qué puede aportar la medicina homeopática al tratamiento de las enfermedades de baja prevalencia? Pues un diagnóstico integral del estado de salud de enfermedad del paciente, considerando todos los factores imbricados en su desequilibrio patológico, personales, familiares y sociales, a través de una correcta historia biopatográfica. Un tratamiento basado en la totalidad sintomática característica, atendiendo a la susceptibilidad individual en la forma de expresar este desequilibrio, tanto en el aspecto físico como mental, emocional, intelectivo y volitivo, principal raíz del grado de expresividad de los estados patológicos ante una enfermedad, mejorando la expresión fenotípica de la carga genotípica del sujeto. Una mejor reactividad de los mecanismos de autorregulación de los procesos vitales de la hemostasia general que asisten a todos los organismos vivos. Una menor necesidad de utilización de medicación química paliativa, disminuyendo los efectos secundarios y la toxicidad a medio y largo plazo que conlleva el soporte de este tipo de enfermedades. Disminución del alto costo de la medicación al ser una medicación económica capaz de reducir el consumo del otro tipo de fármacos. Y una mejora de la calidad de vida de dichos pacientes y de sus familiares. Aunque el enfermo no se pueda curar por una enfermedad de incurabilidad manifiesta, siempre podrá ser aliviado en su sufrimiento con la ayuda de la medicina homeopática, que puede ser compatible con otras medicinas. Estos resultados nos permiten concluir que la homeopatía puede ayudar en la mejora de los pacientes afectados por este tipo de procesos patológicos, complementando sus tratamientos habituales. Estamos convencidos de que el enfoque homeopático integral del sujeto permite su mejoría, disminuyendo la expresividad de sus patologías de forma curativa, preventiva o paliativa en casos de incurabilidad. Sería deseable poder continuar el estudio de nuevos casos y ampliarlo a otro tipo de enfermedades de baja prevalencia, ante los resultados esperanzadores que hemos obtenido. Se necesita seguir trabajando en este sentido para intentar mejorar el pronóstico, la calidad de vida de los pacientes y avanzar en el conocimiento de este tipo de enfermedades desde el punto de vista de nuestra medicina. No desechemos esta posibilidad terapéutica, brindémoslas como un rayo de esperanza a pacientes, familiares y profesionales sanitarios. Siempre será bienvenida. Thank you.
Felicitaciones, doctor José Luis, por esa maravillosa presentación. I'm going to to translate into English some important topics of Dr. Jose Luis Jimenez's presentation. The topic was related as homeopathy in low prevalence diseases, or as rare diseases. In Spain, 3 million of people with these diseases, and with this patient has motor dysfunctions with difficult cases and prognosis. Because of that, there is a high necessity of medical attention. They organized a free project with a rare diseases association, including cutaneous rare diseases as epidermolysis bullosa and the other rare diseases of the skin. They individualized treatment case, and they then do a prescription and a periodic follow-up. After individual repertorization, the most treatment used were calcarea, silicia, natrium, lycopodium, and calendula. After acute phase of the skin diseases, they review again the symptoms to confirm and follow the treatment. And what they observe is that homeopathic medicines reduce the use of other treatments, like, for example, analgesics, corticoids, and improve the quality of life of chronic diseases. So the homeopathic treatments should be an add-on treatment of these kind of patients, because the less of use of other treatments improve the quality of life of these patients. I don't know if Dr. Brender or Dr. Subash wants to make some questions to Dr. Jose Luis.
Here we can conclude that the doctor was very confident regarding the treatment, and whatever I understood, that the homeopathic approach is very beneficial along with the allopathic treatment, especially in the European countries. So I am very thankful to him.
Okay, sir. Okay, Dr. Brenda Sharma, sir, please conclude this session. Say a few words.
Yes, I am very thankful to all the presenters. They have given very scientific evidences regarding the homeopathic treatment, as well as have shown a full confidence with the treatment. So I think with the scientific approach, we can post our system of medicines at par with the other system of medicines. So hoping this will help to the coming generations, and we will definitely make such a pillar which can be helpful for the next generation. Thank you.
Thank you, sir. Thank you all the presenters. So the session has been concluded. Thank you.
Okay.
Thank you, all of you.
Thank you.